Well, good afternoon, ladies and gentlemen. I'm Robert George. I have the honor to be the director of the James Madison Program in American Ideals and Institutions and the former professor of jurisprudence here at Princeton. And it's my very great pleasure to welcome you to our 2024 Harold T. Shapiro Lecture on Ethics, Science, and Technology. The James Madison Program is dedicated to exploring enduring questions of American constitutional law and Western political and moral thought. If you'd like to learn more about our program and everything we do, please visit our website at JMP, James Madison Program, jmp.princeton.edu. And you can also follow us on, it says here Twitter, but I think we're supposed to call it X now. I still say Woodrow Wilson School, Twitter, all these things. And you can our Twitter handle or X handle is @Madison Program. Also, if you go to our website, you can sign up for our newsletter and subscribe to our Madison's Notes podcast. You can learn more about all our upcoming events, both virtual and in person. The annual Harold T. Shapiro Lecture is a highlight of our year here in the Madison Program. The lecture honors the distinguished economist and historian of economics, president of the University of Michigan, chairman of the National Bioethics Advisory Committee under President Clinton, and long-serving president of Princeton University, Harold Shapiro. It was under President Shapiro's distinguished leadership that the Madison Program was founded in 2000. And it was founded on a footing that has enabled us to thrive and grow for these 24 years. I simply cannot begin to express the depth of my gratitude to President Shapiro and to his provost, Jeremiah Ostreicher, for their support and encouragement. And I have the opportunity to thank him here in person, and I ask you to join me in thanking him, President Harold T. Shapiro. And to present our annual lecture in President Shapiro's honor, I'm delighted to welcome to our campus Professor J. Bhattacharya. Professor Bhattacharya is a professor of health policy at Stanford University and a research associate at the National Bureau of Economics Research. He directs Stanford's Center for Demography and Economic Health and Aging. His research focuses on the health and well-being of vulnerable populations, with special emphasis on government programs, biomedical innovation, and economics. His recent research focuses on the epidemiology of COVID-19, as well as on an evaluation of the policy responses to that epidemic. His broader research interests encompass the implications of population aging for future measurement of physician performance, tied to physician payments by insurers, and the role played by biomedical innovation in health. He's published 135 articles in top peer-reviewed scientific journals in medicine, economics, health policy, epidemiology, statistics, law, and public health, among other fields. He holds an MD and a PhD in economics, both earned at Stanford University. His lecture today is entitled, "The End of Free Speech is the End of Science." Please join me in welcoming Professor J. Bhattacharya.
Thank you, everybody. I characteristically have too many slides, so I'm going to talk really fast. No, but I wanted to spend the first half of the talk talking about some science that I did during the pandemic. But the point of the talk is the second half, about how science during the pandemic was distorted and the difficulties of scientists who didn't hold the orthodox views to speak during the pandemic. So in that sense, I am so grateful to be invited to give this talk at Princeton, especially under Professor Shapiro's name. I think it's an act of bravery to invite me. As I hope I'll be able to convince you, and I hope I'll be able to convince you by the end of the talk that it should never again require an act of bravery to allow scientists to speak with one another. And so this is why I've titled it the talk this way. It's both that an end in the sense of the end, we're done with science, and its end in the sense of the telos. You can read it both ways, right? And I think that we want to talk about, I want to talk about the scientific debate that should have happened during the pandemic, and that's why I'm going to spend the first half talking about my perspective on the science on COVID. If I understand, there's an hour for me to talk and a half hour for you to have questions. I'm used to economic seminars where it's combat. People ask me questions all the way through. So if you have a burning question, don't wait. Okay, so I want to talk first with how I got involved in the COVID science discussion at all. In February 2020, I was January, February 2020. I was looking at what was happening in China, and I was remembering back to the earliest days of the 2009 H1N1 pandemic. In that pandemic, what had happened was that there was a very high death rate estimate put out by the World Health Organization very early in that pandemic. A lot of people panicked. Mexico locked down. And there were a number of studies conducted by researchers asking how many people had antibodies in the population at large that were specific to H1N1, the virus that caused that swine flu pandemic. And it turned out that there were, for every person that identified as a positive case, there were 100 people walking around with antibodies that nobody knew about. It basically diffused that pandemic. It turned that pandemic from something people were panicked about to something that people were much more calm about. And I thought in the early days of the pandemic that this virus looked like it spread in very similar ways to the flu. It obviously had very different epidemiological properties than the flu. It's more deadly than the flu, but it spread in different similar ways. And that meant that we were very likely undercounting the number of cases that already had happened. I spent most of my career publishing scientific papers. I told my students all through my career, I've told my students, don't get on Twitter. There's no need to publicize things. Just write scientific papers. That's how you change the world. I now am very sorry for any students that actually listened to my advice. It turns out that was very, very bad advice. Because turns out you have to make a public case. So what I did then is I wrote an op-ed in the Wall Street Journal. It's the first time in my life I ever wrote an op-ed. And it said, is the coronavirus, the title, not chosen by me, was, is the coronavirus as deadly as they say? And I just put forward the hypothesis that the disease was more widespread than we realized. I called for a study to get done to measure antibodies in the population. Right? I'm operating like a scientist. I'm thinking to myself, okay, surely the CDC will run this study because we learned the lessons from the last pandemic. So here's the CDC's estimates early on in the pandemic. You can see this, the WHO, I'm sorry, the CDC. The WHO says that coronavirus death rate is 3.4%. The CDC presented something like a case fatality rate of 2.3%. That's from March 2020. That scared the living daylights out of almost everybody. Right? If 3% of the people that get a disease like this, where we don't have a technology to stop people from getting it, it's a civilization threatening event. Right? So, and that number, the problem with that number, as I told you, is that that's the number of people who got it and then showed up in the hospital. Back then, there wasn't very good testing, and they showed up in the hospital. So among the set of people who got it, how many people in the denominator got it? It's only the hospitalized people, really, that are getting it in that number, and the numerator is the number of the hospitalized people that are dying. That's different than the actual risk most people face from the virus, because many people who get the virus don't end up in the hospital. Most people who get the virus don't end up in the hospital. And so this is the wrong denominator. Right? So that was my scientific hypothesis. I put that scientific hypothesis in a very unlikely place, the Wall Street Journal. And the Wall Street Journal then, I thought that would lead to the CDC running a study like those seroprevalence studies I mentioned. But instead what happened was that a man from the Major League Baseball, who runs testing for Major League Baseball, reached out to me with antibody tests. Other people reached out to me and said, Jay, why don't you run this study? And so within 2 weeks of that Wall Street Journal piece, I had organized, actually it was primarily my close colleagues and friends and former students, organized a study to measure antibody levels in California, in Northern California and Southern California. This is the study. This is the result of that study. Ultimately, it was published in April 2021 in the International Journal of Epidemiology. I published that study in a preprint server in April of 2020. And what are the results of that study? One, that there were about 3% of Santa Clara County, California had had COVID by early April 2020, 3%. Doesn't sound like a big number. In LA County, it was 4%. That does not sound like a big number. But the nature of the epidemiological facts of this disease is that either you smother it at 0 or it's eventually going to 100. 4% is a terrible number. It means that we have a very long way to go in the pandemic, and also that we're not going to stop it. The infection fatality rate was not 3.4%. It turned out to be, in our study, 0.2%. 2 out of 1,000 rather than 3 out of 100. Still a very bad number. 2 out of 1,000, if every American gets it, we're talking about, I mean, it's a very large number of deaths. That number turns out to be pretty close to right, maybe a smidge low, but it was much lower than the 3.4%. It's not as catastrophic as 3.4%. The publication of that study and that op-ed led to an experience I never thought I would experience. Unlike many people in the room, I had spent my career publishing papers in scientific journals, and I was very happy to do that. I never had been on TV, I'd never done an op-ed. I was perfectly happy as a scientist, fighting the fights of scientists. As I said, I'm used to economics seminars, which are combat. That's the kind of combat I was used to, like friendly people talking to each other, arguing over ideas, not over people. The publication of that paper in April 2020, this paper, which was ultimately peer-reviewed, led to vicious attacks on me and my family. There were hit pieces done on me claiming that I'd taken money to alter the results of the study from the founder of JetBlue. There were hit pieces done on my wife. There were, again, death threats directed at me. And even the scientific community were convinced that I didn't know how to do basic math. That was actually fine. That's normal in econ seminars. I'm used to that. So I was perfectly happy with that. I could fight that. But what I didn't know how to fight was this insinuation that somehow I'd done something wrong for doing science. And the study, if it had been heated, would have resulted in a fundamental change in strategy. Right? A few things about that study. There were allegations, for instance, that we didn't have a good test kit, that we had measured that there were too many false positives in our estimates. Well, we corrected for that in the study. There's a formula for how do you test a false positive of a test kit, right? So if you have a prevalence of some condition, like having disease, antibodies to something, there are very, very low levels in the population, and you have a test kit that sometimes gives false positives. If the prevalence is literally 0, then every positive test is a false positive. So that means that if your prevalence is close to 0, you have to worry very much about how accurate your test kit is, how fraction of false positives. One major advantage of us publishing this and all the attention that it brought was that it brought a lot of independent people who evaluated how accurate the test kit was. Right? So this was a positive thing about having a scientific fight on Twitter. Huge numbers of like 14 different labs, independent labs, gave us estimates of the false positive rate of the test kit that we were using. How do you measure false positive rate of a test kit? This is a test kit we got from this Major League Baseball source. The way you measure it is you take the test kit, you get blood from 2018, and that obviously can't have been COVID, and you test it against the test kit. If that blood from 2018 produces a positive, then it's a false positive. And all those 14 different sources, they confirmed what we found, 0.5% for false positive rate, and we had this formula to adjust for the false positive rate, right? So we had the scientific fight down. What we didn't have down was the social fight, this fight that over people didn't like the answer. Because if you remember back to April of 2020, we had just been through basically a month of a lockdown. And there was a tremendous push on President Trump to continue the lockdown. He said we were going to open by Easter, and everyone said no. Right? Huge numbers of people. The lockdowns were tremendously popular. The schools had been closed. But I thought we had the right result. Now it was a surprising result, so it makes sense that you would expect there to be confirmation of it. Right? So we published a paper in May of 2020. Just like very similar to the Santa Clara study, except this was in LA County. We published it in the Journal of the American Medical Association. with almost the identical result. 4% prevalence, 0.2% infection fatality rate, and we had it looked like a confirmation that the result we'd had earlier was not wrong. We published that paper, and then dozens and dozens of scientific teams around the world published very, very similar papers, independent of us. In some places, they had a high infection fatality rate. So for instance, in New York City, the infection fatality rate estimate from studies there was something like 0.9%. In other places, like in Africa, the infection fatality rate estimates were much lower, on the order of 0.000, I'm going to round out O's%. Why is that? Why such a difference in the infection fatality rate estimates? Our estimate, by the way, was pretty close to the median of the estimates that were published in the scientific literature in 2020. So it was right. But why the difference? The reason is and this is the most important epidemiological fact about this that was known in the early stages of the pandemic and should have guided policy. The reason is very simple. There is a huge difference in the risk of dying if you're infected based on if you're young or if you're old. Young people, especially babies and little kids, have almost zero risk of dying if they get COVID. Not zero, but very, very, very low, right? So these are the infection fatality rates estimate implied by the seroprevalence literature, of which I was a part. And so age 0 to 19, the survival rate is 99.997. If you go to babies, you're going to run out of nines before you get there. For older people, it's a much higher risk, right? So 94.5% survival. That's a 6.5%, 5.5% risk of dying if you get COVID if you're over the age of 70. That's a very, very high risk, and especially for the institutionalized population, it's a much higher risk, right? It's really older people, especially older people with multiple chronic conditions, that were really at risk. That's a huge age gradient of risk, and it's an identifiable risk factor. It should drive policy. It should make you think, how can we protect the old? Because those are the ones that are highest risk. And it should, and if you know the nature of these respiratory viruses, you should also understand that we're not going to be able to stop it, right? We don't have a technology to stop it. Yet in 2020, in April 2020, everyone was convinced that the way to suppress the spread of the disease was by lockdown. So I want to show you what I was thinking. So I have a PhD in economics. I spent a lot of my time in my life writing about poor countries, the health of poor countries. And in particular, like how does economic well-being link to the health and well-being of people in poor countries? Among economists, I mean, economists get a bad rap because the idea is that we only care about money. So I'm a health economist. The reason why I do health economics, and from the beginning this has always motivated me, is that the money that we're talking about that's devoted to health is not really money, it's life, right? There's trade-offs fundamental to how we manage our health and well-being. And so when we think as health economists, we're almost sort of like congenitally designed to like think about trade-offs. That's the case here. I was born in Calcutta. My mom grew up in a Calcutta slum. When I was little, we went back, and I lived in that slum for a summer visiting my mom's family. When I was in medical school, I spent a summer living and working in a hospital in rural West Bengal, where they couldn't store blood because they didn't have consistent power. And so every time there was a surgery, they had to go collect blood from everybody. And then if they used it, and they threw it away, right? Among the very first thoughts that I had in the early days of the lockdown was, this lockdown is going to kill a tremendous number of people in the poorest parts of the world. For the last 40 years, the developed world has made a promise to the developing world. We said, look, if you reorganize your economy so that you fit in better with the rest of the world, the rest of the rich world, reorganize your economy so that you produce goods and services that are of use to the rich countries, then you yourself will become rich. And it worked. Almost 1 billion people lifted out of poverty. But the lockdowns represented a violation of that promise almost immediately from it happening. And so what's the consequence of the economic harm done by the lockdowns? I could just see it in February 2020, when I first started hearing about lockdowns, or March 2020 when the lockdowns put in place. It was going to lead to starvation of mass numbers of people. It was going to lead to mass poverty and mass death. And it did. this was the first day of the lockdown in India in March of 2020, happened on the advice of people like Tony Fauci. There were 500 million workers, migrant workers, living in the big cities of India. They make their living by, day to day. They sell coconuts that represents their entire wealth to rich people on the street. They'll take the money from the coconut, the sales, they buy coconuts for the next day, and they feed their families with the rest. And that's it. So the lockdown meant they couldn't sell their coconuts. That meant their life savings was gone. The Prime Minister of India said, you have to go back to your home villages. The Indian infrastructure is not set up to move 500 million people in a single day. And so 500 million people found some way, sometimes by train, sometimes by bike, sometimes by walking up to 1,000 miles. And on the day the lockdown happened, 1,000 people died that day from the lockdown order. Academics have written about it, called it the New Trail of Tears. The World Health Organization started, the UN and other organizations almost immediately started saying, look, these lockdowns are going to kill people. They're going to kill a lot of people. This is an estimate from April of 2020. April 2020. COVID will double the number of people facing food crises by up to 130 million people. And it says the economic impact of COVID-19, this is really not the economic impact of COVID-19, it's the economic impact of disconnecting the rich world from the poor world, the global south from the global north via the lockdowns. All those supply chains, the pointy end of the supply chain is some poor guy who loses his job, can't feed his family, and they starve, right? That is what that estimate was saying in anodyne language. There's a science paper that was published in Science Advances in February 2021. We don't have a global estimate that's I think trustworthy yet, but the early indications from established surveys was that those estimates were not that far off, right? So for instance, this paper that was published in Science Advances by some prominent development scholars, household coping strategies and government assistance were insufficient to sustain pre-crisis living standards, resulting in widespread food insecurity, starvation, dire economic conditions even 3 months into the crisis. Right? So the lockdowns meant for the global poor starvation. There were stories like this in July 2020, right? 10,000 babies dying from virus-linked hunger. And I kept thinking, these stories are going to shock the conscience of the West. How can we sit here saying that we're keeping people safe when there are estimates like this, pictures like this, but that never came. I wrote an article in the Financial Post, I guess it was, the only place it was a Canadian article, couldn't get it published in the US, where the last line is, we are a moral people, expecting that this, pointing out this, right, calling for a different strategy, and it didn't hear, because we were in the grips of a moral panic in 2020. We decided that we knew we were going to pull up our drawbridges to keep us safe. The World Bank put out this estimate. So that you see, this is from 2015, 739 million people in dire poverty. Dire poverty is $2 a day less of income. And that line down is the huge success I was telling you before, right? So over the last 30 years, 1 billion people lifted out of poverty. That's the line, that's the projection down. The dashed line is the projection of what would have happened had there not been lockdowns and the COVID-19 pandemic, right? That we would have continued this decline to 581 million people in dire poverty. And the blue line is what actually, it was the projection of what happened if we did the lockdown, according to the World Bank in 2020. And what we're talking about is 100 million people put into dire poverty that would not have otherwise been there, right? The difference between 656 and 581, I guess not quite 100 million, but you get the gist. A lot of people put into dire poverty. 100 million people-ish. UNICEF put out an estimate that 150 million additional children plunged into poverty due to, again, they always say COVID-19, but really it's the economic policies adopted to address COVID-19, right, to the poverty caused by the lockdowns. In March of 2021, this is the BBC was reporting on a study done in about South Asia. 228,000 children in South Asia killed by March of 2021 from the economic dislocation caused by the lockdowns. The World Health Organization and Gavi and all these organizations, that their job is to have vaccination programs for basic vaccines for kids. You know, measles, mumps, all these vaccination programs that save kids from diseases that actually do harm them, unlike COVID-19. They stopped those programs in 2020. They diverted the resources from those programs, stopped vaccinating children so that they could deal with the COVID-19 pandemic in places like Africa, where only 3% of the population is over the age of 65. And so the risk of dying from COVID for the typical African person in Africa was very, very, very low because they're young. And instead of focusing on the diseases that harm them, we focus on the diseases that harm old people in the global north. Okay, so that's this is the consequence of that. This is from April of 2023. UNICEF, we're facing the largest continuous decline in childhood vaccinations in 30 years, right? An incredibly short-sighted policy in 2020, but you couldn't get anybody to listen. And pointing this out was a very difficult thing in 2020, right? It's not that you couldn't get anyone to listen, but when you said it, you were subject to, and I know this from personal experience, you're subject to vitriol, attacks, like especially since I have a PhD in economics, it would be very simple. It's like, Jay, why do you care about money? You don't care about like human life. Okay, so what about schools? I'm gonna be almost done with the lockdown part because it's too depressing to think about. I could go on literally for hours and hours and hours to show you the collateral harm. There isn't a single aspect of human well-being that was not damaged significantly, especially for the poorest people, especially for the most vulnerable. But I can't not tell you about kids, so let me just show you about kids, right? So we closed schools in this country, in many states, for up to a year and a half. We're lucky in this country, actually. We closed those schools, and our kids actually had at least some modicum of schooling. Like they could get Zoom school, right? It was horrible for my kids personally to have Zoom school, but at least they had some school. There were states that fought back, right? In fall of 2020, Florida opened its schools, in part on the basis of my advice. But in California, we had our schools closed for basically 2 academic years. In the rest of the world, especially the poorest parts of the world, the kids were not so lucky. They stayed out of school for 2 years and just stayed out of school. Not Zoom school, nothing. Right, so this is a story from Uganda. This is a story in NPR from Uganda in 2022, I think it was. Yeah, February 2022. Kampala, Uganda. On January 10th, Uganda reopened schools after the longest closure in the world due to the coronavirus pandemic. For most students, it was their first time back in the classroom in nearly 2 years. 15 million children missed school for 2 years, right? If you care about inequality, this is a generational inequality that we will have to face in the next decades, right? 15 million kids out of school means those kids do not have basic human capital to learn how to do jobs that will allow them to lead healthy, productive lives. And 4.5 million of those kids never came back from those closed schools. Right? They were just gone, lost to follow. 4.5 million Ugandan kids. This story is not just unique to Uganda. In the Philippines, they had a policy that they kept the kids wouldn't let kids out of the house for 2 years. So you had kids born in the Philippines that didn't see the light of day for 2 years. And the impact, again, is on the global south is almost impossible to exaggerate, right? What we're talking about is a tide of generational inequality coming up, a tide of poverty in a way that we should have cared about. The most heartbreaking thing, and this is from a UN Office of Drugs and Crime in 2021, is why some of those kids stayed out of school for so long and never came back. We put families in this place where they had to choose between what I'm about to describe and starvation. And a lot of families chose this. The reason why a lot of those kids never came back was that they sold their children into sexual slavery or to child labor, is what this Office of U.S. Drug and Crime. The effects of the pandemic on children have been far-reaching, with children trafficked for sexual exploitation, labor, forced marriage, forced begging, and forced criminality. based on findings from online surveys with survivors of trafficking in persons and frontline stakeholders conducted at the beginning of the global pandemic by the OSCE. What we have is an utter human rights catastrophe that happened with the public health authorities of this country perfectly happy to sign on with. And it's not like I'm giving you, fringe reports. These are like all UN, UNICEF. These are like the bodies that are impaneled in order to protect and represent the interests of these people. And they're screaming as loud as they can, and we're just ignoring it. In the U.S., a colleague of mine, Dimitri Kasakis, who's the editor of JAMA Pediatrics, he did this estimate in November. He published in November 2020. In the summer of 2020, he released the preprint version of it, estimating how many. We closed the schools in March of 2020 in the U.S. for 3 months. What effect did that have on the future health and well-being of the kids that were just had like 3 months of Zoom school? In the health economics literature, there's a solid set of findings suggesting that even short interruptions of children's schooling can have long lifetime consequences on human health. Because people, the kids that have interruptions in their schooling, because they're less well educated, they're less likely to have good jobs, they're more likely to be in poor health later in life. Right? There's a long line of health economics literature that establishes this, and Kostakis was reflecting this in this estimate. His estimate was that this decision analytic model found that missed instruction during 2020, it means spring of 2020, could be associated with an estimated 13.8 million life years lost. That's in the US, from US studies, and an estimated 0.8 million life years lost based on European studies. Why the difference between the US and Europe is because Europe did not close its schools for nearly as long and nearly extensively as we did. Right? They avoided a lot of the worst damage to children.
Can you explain what JAMA is so people know?
Oh yeah, so JAMA is the Journal of the American Medical Association. It's a very, very prominent journal. And like I said, Dimitri Kostakis was the editor of JAMA Pediatrics. This estimate was, I think he had to revise this estimate downward of only 5.5 million life years lost, something like that. Right? So we cost our children 5.5 million life years. Our children in this country. And it's not equally distributed. Right? So the impacts were felt most greatly on poor kids and on minority kids and on working class kids. Right? So imagine if you're a single mom and you have a lockdown, but you have to still go work, and you have a 5-year-old who goes to kindergarten. Of course, he doesn't go to kindergarten. What he does is he sits at home and somehow is supposed to learn to read by himself on Zoom school while mom goes to work. Right? That's the position we put people in, and you could see the results. So if you were well off, you could hire tutors. Many of whom were teachers that didn't have to go to work because the schools were closed. So you had pod schools for richer people, where poor kids basically had no school or very, very poor school. So low-income kids, full 60% had very poor instruction, 40% had no instruction in spring of 2020. Right? So you have a situation that is, in my view, the most classist policy that I've ever seen in my life. I called it trickle-down epidemiology. But the theory is that somehow, if we make the poor suffer, we can all, meaning the relatively well-off, can benefit. And I kept thinking, okay, why are we not doing this? The reason why Europe stayed open was because of the Swedish experience. This is a study that was published in New England Journal of Medicine, again, one of the very top medical journals. And it was published by Jonas Ludvigsson, who is a pediatrician in Sweden. And it was published in 2021, but there was an early version of it out in summer of 2020. What he did is he looked at Swedish schools. Now, Swedish schools for kids 16 and under stayed open the entire pandemic. They didn't have Zoom school. They didn't have social distancing. They didn't have masks. They just had school. They just had regular school for every kid 16 and under. I think there may be a school here and there might have closed, but there was no order by public health to close. And as a result, the school stayed open for kids in Sweden. And Jonas Ludvigsson did a study of this, of the results of this. So from March to June 2020, a total of 15 children with COVID-19 in Sweden were admitted to an ICU. In fact, ICU is a intensive care unit per 100,000. So 15 out of 0.77 per 100,000 children in the age group. So 7 out of a million or 8 out of a million kids admitted to an ICU. No children died, right? And they just had school. So the risk to children was very, very low, as you probably could tell from the infection fatality rate estimates I showed you. What about the teachers? The teachers, it was a very, very different, it was actually quite amazing. Fewer than 10 preschool teachers and 20 school teachers and children received intensive care for COVID-19 up to June 2020, which is, as compared to other occupations, excluding healthcare workers, this corresponded to relative risks of 1.1 and 0.49 among preschool teachers and school teachers. What that means, this 0.49, that means that school teachers were half as likely as people in other occupations to have intensive care for COVID-19. By being in school, they were protected relative to other workers in the population. This is the result that opened the schools all through Europe. Right? And it's coming out in the summer of 2020. Jonas Ludvigsson, the lead researcher, he was subject by the Karolinska Institute to an investigation for having written this piece. And he wrote that he was going to stop working on COVID-19 as a result of this, although he did probably one of the most important studies during the pandemic. And was subject to tremendous harassment, again, death threats and attacks for this actually very happy result that likely resulted in tremendous numbers of school children in Europe having an education that they deserved. Did the lockdowns work? Okay, so why would a lockdown work? It's very, very intuitive that a lockdown ought to work. How could it not work, right? How are respiratory viruses spread? By people breathing near each other. The ideology of the lockdown is that we are all primarily and merely biohazards, right? So if we keep people apart from each other, human beings apart from each other, you could stop the disease from spreading because each of us, all we are biohazards and threats to each other. That's the primary ideology of the lockdown. Every single aspect of our COVID policy follows from that ideology. Our closed schools, the social distancing, the masks, every single aspect of it is on the premise that we are primarily and merely biohazards. The problem is that the lockdown ideology, as attractive as it is, right? You just keep people apart, just doesn't work, right? Just give you some, one really simple thing. The disease is spread by aerosols. Aerosols, the way they work is that I breathe. The viruses that are in my breath, they sit in little tiny droplets which float in the air, right? The droplets, the spit that you see is only a very, very small part of it in one sense. Like the stuff that floats in the air is the more important part. So I could breathe in this room. You could come in here 2 hours later, 3 hours later, I'm gone, very far away, and you could get COVID from me. Right? That is the way that COVID often spreads. And so it's not simply that I have to keep everyone apart from each other. We have to keep people in hermetically sealed bubbles. And I don't have to tell you this, I hope, but that's not physically possible for most of the world. We can't live, and even if it is possible, if we can live our lives, sort of Howard Hughes-like, all ensconced away, it's not good for us as human beings. We are not meant to be alone. We're not created to be alone. We need the company of others in order to live as fulfilled human beings. And the consequence of this fact is that lockdowns cannot work. Especially for the poor, they cannot work. Right? So in July of 2020, a colleague of mine at the University of Chicago Anoop Malani ran a very interesting study in Mumbai, India. What he found was that in the poorest parts of Mumbai, in the Dharavi slums, the other slum parts of India, of Mumbai, 70% of the inhabitants had antibodies that showed that they'd already been infected by July 2020. 70%. Whereas the richer parts of richer parts of Mumbai was 20%. This gap between rich and poor in exposure, and this is during a severe lockdown in India, mind you. right? The poorest cannot abide a lockdown. In Peru, there was this tremendous draconian lockdown, and the disease spread everywhere anyways, because the poorest cannot abide a lockdown. In January 2021, I published a paper with John Ioannidis, Aaron Ben David, and Christopher O, where we looked at Sweden, which did not lock down, had not mandated school closures, had not mandated closed businesses. Actually, also South Korea did the same thing. They did not mandate school closures. They did not mandate business closures. They did advise people, if you can stay home, right? It's not like they did nothing. It wasn't a laissez-faire policy. It was a policy that said, look, if you're at high risk, be careful. And then they gave resources to people so that they could stay home if they couldn't otherwise afford to do so. Right? So it was not a laissez-faire policy. It was a policy focused on protecting vulnerable older people. And they made mistakes early in the pandemic. But if you compare the South Korean and the Swedish experience versus other countries that did lock down, that did have mandatory school closures and all that, what you found was no difference. While small benefits can't be excluded, we do not find significant benefits in case growth and more restrictive NPIs is non-pharmaceutical interventions, which is a synonym for lockdowns, basically. In similar reductions in case growth may be achievable with less restrictive interventions. I think we were wrong about that. I'm not sure that we have any technology to slow the spread of the disease or something like COVID. There was a massive meta-analysis done by Steve Hanke and his colleagues. Steve Hanke is a professor at Johns Hopkins University. A meta-analysis, now if the analysis of the literature is interesting because the literature bifurcates in two. One branch of the literature looks at models. These models of disease spread. You remember them from the pandemic? Every time you'd see these, it's like weather forecasts except for COVID spread. You remember that? So people would use these models and say, okay, if we just keep people apart in the model and you play the little simulation game, how many fewer people will get COVID? And then the gap would be how much curve we flattened and how much we prevented disease spread. All of that curve flattening was theoretical. It was in the model. How many people versus a whole another branch of the literature that instead of doing that, they compare places that have different policies but are otherwise similar to each other and ask how effective was it. There's a huge difference in what these two literatures find. The modeling literature finds a tremendous impact from lockdowns, huge numbers of lives saved from lockdowns. Whereas the literature that actually looks at what actually happened in actual societies has a real difficult time finding any lives saved at all from the lockdowns. Here's the estimate. Here's the final thing from their Hopkins meta-analysis. Result of their meta-analysis support the conclusion that lockdowns in the spring of 2020 had little to no effect on COVID-19 mortality. Right? That's comparing the real-world data versus the real-world data. And they rejected the modeling counterfactuals. The reason they rejected it is because things like this. Right? So this is from Denmark. The green line that looks like it's going off to infinity in scenario S2 or whatever, that's what would happen if you don't have a lockdown. The gray line underneath is what would happen if the curve flattened with a lockdown in the models. And the blue line underneath at the bottom there, that's the actual number of cases that happened over that same period. Right? If you look in the modeling literature that actually tries to compare it against what actually happened, you'll see the same thing over and over again. It looks just like this. Right? The models were not accurate representations of human interactions that would lead to diseases or not. I'm not saying that we always underestimate it. What I'm saying is that the counterfactual, if we lock down versus if we don't, you can learn almost nothing from the models from that. Okay, so that's what the literature says. The punchline then is that all of this means that we did a lot of what we did for nothing, and it caused tremendous harm to the most poor, the most vulnerable people in the world. Okay, a couple of more things. Oh yes.
Would you call that incompetence or mendacity or something in between?
So the question is what I call this incompetence or mendacity. I mean, I think my colleague John Ioannidis, he has this saying which I think is really insightful, right? So he says, I'm a scientist, therefore I'm wrong. Right? As scientists, we almost always are wrong, right? It's a bright moment when the thing that we think lines up with reality. and it's a great day. We make our careers on the best days, not on our worst days, thank God. The thing about science is that we learn from each other, right? When we make mistakes, my colleagues are always very happy to point out how many mistakes I've made. It's great fun, right? The problem, and I'm going to get to this in the second half of the talk, is that the self-correcting mechanisms of science were not allowed to function during the pandemic. It made it almost, I mean, I was screaming this as far as I could, but it was very difficult to get this message out. And a lot of people I talk to even now today here tell me that they're hearing this for the first time. It's that lack of self-correcting mechanism, that free speech that should have allowed science to occur, that didn't, is the reason why that we had got what we got, right? That's why the end of science is the end of free speech. The end of free speech is the end of science, right? Okay, so here's California and Florida. My kids locked down for a year and a half for this. This is all cumulative, age standardized, all-cause excess deaths. A lot of words. Let me just tell you what that means. You take all of the people, the trend in mortality rate in California from 2015 to 2019, and you ask, if those trends continue, given the age structure of the population of California, how many deaths would you have expected if there had been no pandemic in 2020 to 2023? And you compare against the actual number of deaths. A positive number, that means a lot more people died than you would have expected given the trends from 2015 to 2019. So all-cause excess deaths is how many extra deaths there are relative to what you would have expected given the earlier trends. And age standardized, you have to do age standardized because the age structure of California is many, many young people. The age structure of Florida is many, many old people. So you want to say, okay, if they had the same age structure, what would you have expected? So what this shows is that California, red, had higher all-cause excess deaths than Florida. Not something you would expect, but only if you realize that the lockdowns have almost nothing to do with death. Like, they don't protect people from dying. In fact, they might even cause death. A lot of the deaths in California, it turns out, are younger people. It is not COVID. It's drug overdoses, suicides. So what you have is this absolutely catastrophic result of the policy we followed. Let me show you Sweden. I put Florida and California still up there. We did really poorly compared to the rest of the world, especially compared to Europe. So even Florida did poorly. The estimate of this, I want you to focus on this blue line right over here. See this blue line? That's Sweden. Up until 2022, it looked like Sweden was doing worse than its neighbors. Its neighbors meaning Norway, Germany, and Finland. But sometime in 2022, cumulative all-cause excess deaths in Sweden started going down, whereas cumulative all-cause excess deaths in Norway, Finland, and Germany kept going up. And Sweden, if to the extent it's possible to win a pandemic, won the pandemic. Right? They have among the very lowest all-cause excess deaths in the world without a lockdown. The estimates of learning loss in Sweden tell the story. There's no learning loss among the kids of Sweden because they didn't have a lockdown. They just had regular life during a pandemic. They protected human life better, and they did better by their children than we did. Okay, all right, so now the second half of the talk. So why did you not hear this? Who heard at least parts of this story? Who's hearing some of this for the very first time? Okay, so the second part was completely outside of my experience, and I still have a hard time accepting that it happened, but it did. That paper I showed you, the paper, this one, this paper, tried to publish this in a preprint journal because we had this result in late October, early November 2020. A preprint journal is a journal where you don't have to peer review, right? The idea is that you just publish it. And the goal isn't to say that it's peer review, the goal is to garner peer review from other people early before you submit it to a journal for peer review. That's what we did with the Santa Clara study before it was ultimately published. It led to all kinds of good things, including all of those independent verification of the false positive rate of our test kit. When we sent this to to medRxiv, which is the standard place you publish this for peer review, for open access before peer review, medRxiv said we won't publish it. This is supposed to be a place that publishes basically everything, right? It's not a peer review, it's a communication with the scientific community that, look, we have a result you should see, give us your comments about what's wrong with it so we can correct it, so we can send it to a journal for later. And the open access journal said, no, we're not going to publish it. Ultimately, it's published in the European Journal of Clinical Investigation, a top journal in the medical field. This paper by Steve Hankey, which I showed you before, this meta-analysis, he publishes on his webpage. He tries to get it published in SSRN. SSRN is the Social Science Research Network. Again, it's like a preprint. It publishes basically everything in social sciences. You can just go send it there as long as it's not obvious like crankery. And this guy's a very prominent economist. He publishes everything. They reject this piece. He rejects this piece.
Why? Why did they reject? Did they give a reason?
Yeah, they said, so I don't know what they told Steve, but what they told me for that piece was that the topic is too hot to publish during a pandemic. That it needs to first be peer reviewed, otherwise it might cause harm. Right? This is the scientific journal. So we published this. Steve and I published this piece in Econ Journal Watch, complaining about this. What I just told you is my speculation about what they were thinking. I'll tell you, like, I think that the open access movement, which I thought was a very, very good thing in science, right? A lot of the problem in science is that it takes forever to get controversial things published. By having open access, you give scientists access to other scientists' ideas before you've gone through this gatekeeping, the peer review process. It's supposed to publish controversial pieces. It's supposed to publish rough pieces. It's supposed to garner more scientific discussion. But during the pandemic, a lot of journals and even the preprint servers thought that it was too dangerous to actually allow science to happen. I guess why did I put this here? I should have done this earlier. Let me just go back and give you one last thing about lockdowns and why they didn't work. I've made an assertion that poor communities can't abide a lockdown. Let me give you the evidence of that. This is from Toronto, Canada, in the earliest days of the pandemic. The gray line is the 30 poorest neighborhoods of Toronto. The blue line is the 30 richest neighborhoods of Toronto. And you can see this is like March of 2020 to October of 2020. Almost all the COVID deaths happened in the poorest neighborhoods of Toronto. I just put this graph up here just because it's a stark graph, but what I tell you is that every single city you looked at had exactly this same pattern, right? So for instance, here is LA County, the data from LA County as of March of 2021. The poorest neighborhoods of LA County, 30 to 100% poverty, had 393 deaths per 100,000 population, age adjusted. And the richest neighborhoods in LA County, Beverly Hills had 118, 1/3. Right? Actually, interestingly, Florida, which opened up, had much more equal distribution. So this is deaths per 100,000 for black populations in Florida, white populations, Hispanic populations, almost equal. Actually, it's higher for whites. Where you compare with LA, which was locked down, lockdowns harmed the poorest neighborhoods the worst. Right? It was incredibly unequal. This is why I call it trickle-down epidemiology. Okay, the Great Barrington Declaration. So now I told you this is a personal view. So in October of 2020, I wrote something which is the most thing I'm going to be, when I go to my grave, it'll still be the thing I'm most proud of writing. It's called the Great Barrington Declaration. It's a one-page document. You can go find it online, still there. I wrote it with Sunetra Gupta, she's in the middle right there, and then Martin Kulldorff. Sunetra is a professor of theoretical epidemiology at Oxford University, an absolutely brilliant mathematician. She's also an incredible novelist. She's a labor voter. She's, I think she's a socialist. I mean, it's hard to tell. She's amazing. Whatever she believes, I believe. And then Martin Kulldorff is a Swedish biostatistician, epidemiologist who is responsible for the way that the U.S. CDC and public health authorities in the country track infectious disease outbreaks. Like he built the statistical infrastructure for vaccine safety surveillance. I mean, I've known about his work for decades. It was an absolute thrill to meet him. He organizes this event in Great Barrington, Massachusetts, which I'd never heard of before. I go out there, meet Martin and Sunetra, and we decide that we were going to write a one-page document so the entire world would know that there were scientists that disagreed with the lockdowns. The lockdowns happened because everyone thought that all scientists with relevant experience agreed with them. Right? There was an illusion of consensus in favor of the lockdowns. The idea was that if you were opposed to them, you must be either some horrible libertarian that just cares about money, or some crank, or you want people to die. You want grandma to die. So we wrote the Great Barrington Declaration in language that's accessible to everybody. Like you can go read it, still online today, greatbarringtondeclaration.org. It just says, it's a version of what I just gave you, right? The talk that I just gave you, with some sprinkling of herd immunity, because that's Sunetra's expertise. The key ideas of the Great Barrington Declaration are two. Well, one is that, actually the scientific basis I've already told you. There's this massive age gradient in risk, with the oldest people being the highest risk and the youngest people being low risk. So the first plank of the Great Barrington Declaration is better protection of high-risk older people. I'm not going to spend a lot of time on this. I just want to give you just a sense of why that's so important, because it's a matter of what your goals are in policy that set what you do in policy. Right? Have you ever wondered why did Andrew Cuomo send COVID-infected patients to go to hospitals, to nursing homes in the early days of the pandemic? I don't think he's an evil guy. I think he wanted to do good. What his advisors were telling him was, you need to make hospital systems have very few patients so they don't get overcrowded. The goal of his policy was to empty hospital systems, protect hospital systems. If the goal of his policy had been to protect vulnerable older people, under no circumstance would he ever said, let's send COVID-infected patients to the nursing homes. Right? That would never even occur to someone whose whose goal was to protect vulnerable older people. If the protection of vulnerable older people had been the primary guidestone of how we managed the pandemic, a huge number of things would have been vastly different and better. Instead, what we had was, in Montreal, nursing home workers abandoned their posts, and older patients with dementia died of dehydration because people abandoned their posts. We had people die alone in hospital beds with their families not allowed to come see them, older people. We canceled funerals, where you couldn't have a funeral, you couldn't go bury your parents. Rather than focusing on a futile bid to try to stop the spread of a disease, a thing that we do not have a technology to do, we could have instead devoted our resources and thought of how to better protect vulnerable people. This is what we were hoping out of the Great Barrington Declaration. Not that we had a 1,000-page plan of how to do it, but that we wanted to engage the creativity of public health officials and public health professionals in thinking better how to better protect vulnerable people, to reorient the strategy, if you will, for the protection of vulnerable people. So that was the first plank. The second plank, young adults live normal lives. Right? Let children go to school and play with their friends. That's it. That's the whole Great Barrington Declaration. This is, by the way, I've said it's the most thing I'm going to be most proud of. It's also the least original thing I've ever written in my entire life. It's the old pandemic plan. For a century, we followed a plan very, very similar to this for every single respiratory virus pandemic. The idea is protect the most vulnerable people, develop technologies as rapidly as you can to try to better manage the disease, but in the meantime, don't disrupt society, because the disruption of society is going to hurt the less vulnerable to the disease, but more vulnerable to poverty, more vulnerable to the unequal societies we live in. The strategy, this is just to give an example of how, I could give you a million different examples, but to give you an example from in Sweden. When the vaccines came out in 2021, Sweden didn't have enough vaccines. Europe had a shortage of vaccines relative to the United States. And so by March this is the number of cases in Sweden in the winter of 2020, and then in the spring of 2021. They had two major waves in 2020 and early 2021. And the vaccines the campaign, they start over here, and by March of 2020, only 7% were vaccinated. 7% of the elderly in Japan were vaccinated by March of 2020. In the middle of a massive wave of cases, only 7%, but they used every single dose for older people. Every single dose went to an old person. Right? In fact, some Swedish public health official was 40 years old, jumped the queue, got the vaccine early, and they fired him. Right? Whereas in the United States, in California, there was all these debates about, well, we should give it for young minorities. We should give it for healthcare workers. We should give it to all, where the idea is we need to reduce the spread, right? Use the vaccine to reduce the spread, rather than use the vaccine to protect the lives of older people. Sweden decided on the second strategy, and so what happened? There's this massive wave of cases in winter, and a massive wave of deaths in winter, 0% vaccinated. A massive wave of cases in spring, 7% vaccinated, no deaths. Because they took the pool of people that were most likely to die if they get the disease out of the pool. Right? That's what focused protection, it's the decoupling of cases from deaths. It's not to remove the number of cases, that's not possible. It's to make it so that the cases don't produce the bad outcomes we saw. The decoupling of cases from deaths is the goal of focused protection. Okay. You guys have been wondering, okay, how much time do I have? I got half an hour? I got half an hour? I got half an hour. All right, okay, so let me show you this last half. This part is almost surreal. I still can't believe this happened. I still, to my dying day, I'm going to not understand how this could possibly happen, but it did. The reason why people did not hear about this, about all of the data I showed you, the strategies I've talked about, is because there was a concerted effort by the top of the American and world public health bureaucracies to damage and smear the reputations of every single scientist of prominence who spoke up against the lockdowns. Now, I sound like a conspiracy theorist to you, I'm sure, because as I say this, I sound like a conspiracy theorist to myself. Let me just show you the evidence. Okay, so October 4th, 2020, we wrote the Great Barrington Declaration. On October 8th, 2020, Francis Collins, a man I greatly admired before the pandemic. He's a Christian, I'm a Christian. He was the head of the Human Genome Projects, one of the most important scientists of the 20th century, and justifiably the head of the NIH. He wrote an email to Tony Fauci on October 8th, 2020. Hi, Tony and Cliff. Cliff Lane is the aide of Tony Fauci. See Great Barrington Declaration. This is my webpage. This is the webpage that resulted in, we put the Great Barrington Declaration on a webpage where people could like click a link and sign. Almost 1 million people signed it. We got translations from 40 different countries. People just sent them to us. The thing went viral. I thought, okay, this is it. The lockdowns are over. Everyone now knows that there's a big, healthy debate going on among scientists. We're going to have to get covered. We did get covered, actually. This proposal from Francis Collins, this proposal from the 3 fringe epidemiologists, that's me. He's talking about who met from the 3 fringe epidemiologists who met with the secretary. We met with Secretary of HHS Alex Azar on the eve of a couple of days after we wrote the declaration, organized by a meeting organized by Scott Atlas. This really upset Francis Collins, I could tell from this email. Seems to be getting a lot of attention. Even a co-signature from a Nobel Prize winner, Mike Levitt at Stanford. You can't get more fringe than Mike Levitt at Stanford. There needs to be a quick and devastating published takedown of his premises. I don't see anything like that online yet. Is it underway? Tony Fauci. Pieces like this then started coming out. Right? This was in the Washington Post, published by Rochelle Walensky, who was the future CDC director. Trump wants to try for herd immunity. Without a vaccine, it could kill millions, right? So in this piece and other pieces, I kept seeing the word fringe was there. I kept seeing the word let it rip. If you look through the Great Barrington Declaration, there's not one word nowhere does it say let it rip. Right? That's Tony Fauci's characterization of what we said. The press latched on to herd immunity strategy, because we use the words herd immunity in the Great Barrington Declaration. Herd immunity strategy, by the way, is an insane characterization of this, right? So the fact, herd immunity is a biological fact of any disease that has any immunity at all. It is not a synonym for getting rid of the disease. It's a synonym for describing how diseases spread and don't spread from time to time. When the fraction of the population that is immune to a disease is above the herd immunity threshold, the number of cases comes down. When it's below the threshold, the cases go up. And endemic diseases, you sort of fluctuate around a herd immunity threshold. You get the diseases come and go, right? It's a way of describing disease dynamics. When you have a new disease, you're not anywhere near that herd immunity threshold. And so the disease, the epidemic ends when you get near the herd immunity threshold. It doesn't mean the disease is gone forever. It just means that it's entered an endemic stage, right? It's a mathematical idea. It's kind of akin to talking about, this is something Martin Kulldorff likes to say, when you land an airplane, you have to take into account gravity, right? That's just a physical fact about the world. There's no such thing as a gravity strategy to land an airplane. The gravity is going to apply no matter what strategy you use to land the airplane. The goal is to land the airplane as safely as possible. Same thing with herd immunity. It's a biological fact. There's no such thing as a herd immunity strategy for managing a pandemic. There's only, do you lock down? Do you do focused protection? Do you do nothing? What do you do? Like it's like landing an airplane. You want to do it as safely as possible, but herd immunity is just a reality, biological reality. Herd immunity strategy is a slur aimed at making sure people don't think about this. And so there's these, the press is filled with these hit pieces about me, essentially accusing me of wanting to kill people. And then the death threats start coming, the vicious attacks on campus at Stanford. Right around this time, Scott Atlas, who was the president's advisor on COVID, he was giving the president very, very similar advice to what I just said. Protect the older population better, especially nursing homes. We're not doing a good job protecting nursing homes, Mr. President. Mr. President, it's very important to open the schools. We're hurting our children for nothing. That's the advice he's giving the president. I know because every day he's calling me saying, Jay, I can't believe this. They're not listening to me. They're not looking at the data that I'm showing them. He wrote this book afterwards. It's a long cry of frustration that he was unable to get the president's advisors like Tony Fauci to even look at the data that were coming out of all these places. So my colleagues at Stanford, 100 of them wrote a letter essentially accusing him of violating ethical norms of public health for giving the president this advice. And then the faculty senate of Stanford censured him. Only 3 people in the faculty in the history of Stanford have ever been censured by the university, and he's one of them. And the language they used was religious language. They said he was anathema. And it looked to me like an excommunication. It was the language of excommunication at Stanford. The signal was very clear. I got emails from friends of mine who signed the letter attacking Scott, and they told me that they felt, these were like junior professors, they told me that they felt tremendous pressure because it was the former dean of the medical school that organized the letter, that they were like, they felt tremendous pressure because their department chairs signed the letter, voted in the faculty senate. Because if they don't sign, they're going to look like they're outsiders, and they're worried about tenure. Right? The social pressure to sign letters like this, condemning scientists who disagreed, was tremendous at universities. It's not surprising, right? The head of the National Institute of Health does this just to give you some sense of what a violation of norms that is, and what an abuse of power that is. The National Institute of Health controls $45 billion, at this point, $45 billion of funding to universities. Stanford gets something like $700 million a year of NIH funding. And it's not just the money, right? Money, of course, buys lab space and the ability to do your research, but it's also the social standing you get from getting an NIH grant, right? I have tenure at Stanford University in the medical school. I got tenure in part because I was successful at getting NIH funding. The signal is to every NIH-funded researcher, or every researcher that hopes to be NIH-funded, don't step out of line or else. right? It's essentially a silencing of any possibility of speaking up against the preferred policy of Francis Collins. Okay, I joined Twitter in August of 2021. I think I told you, I told my students forever not to join Twitter. You make a big impact by doing science, I said, right? In August 2021, I violated my rule and I joined Twitter, in part because Martin Kulldorff asked me to do it, and I always say yes to Martin Kulldorff. It was really great. It was actually really fun. I joined, and almost immediately I got 100,000 followers. I mean, that's a lot of followers, you guys. I don't want you to brag, but I mean, that's a lot of followers. It felt great. Like I could finally defend myself, right? When there's a hit piece on me, I could like say, look, this is wrong, this is unfair, or whatever it is, right? I could share my scientific ideas with the public, and it felt great. Like I would publish things on Twitter, and then like a whole bunch of people would like it. I got the dopamine hit from people liking it. You know what I'm talking about, right? But the problem was, like, I was speaking to the choir, right? I joined Twitter because I wanted to reach people that disagreed with me, that were still fair-minded. Like, I mean, I didn't want to, I was already getting death threats. I didn't need Twitter people to give me death threats, so I blocked those people. But anyone who like disagreed with me in a fair-minded way, I was very, very happy to interact with. But it happened very rarely, right? I was speaking to the choir, and I found out when Elon Musk bought Twitter, I found out why. One other thing, when we're talking about Elon Musk, I could see from my friends' Twitter accounts, I could see where the line was where you were not allowed to cross. If you said that there's such a thing as immunity after you get COVID and recover, and that meant that the marginal benefit from the vaccine was low, that's a line you shouldn't cross, and your account will get banned, even though it's scientifically true. If you said that there is such a thing as vaccine injury, young men getting myocarditis at unacceptably high rates, you've crossed the line and you're going to get banned. Right? This happened, this pre-Elon Musk Twitter, that happened over and over again to my friends, and so I never said those things. I silenced myself on Twitter because I wanted to still have the capacity to tell people what some of the other stuff I cared about. Every scientist I know that was on Twitter saw the same line, and some of them reacted by transgressing it and getting kicked off, and some of them reacted by censoring themselves. Martin Kulldorff got kicked off of Twitter because he said that if you recommend people to wear masks which are very, very porous, like cloth masks, and you say it's going to protect you against getting the disease, it might actually end up killing people because older people will wear the cloth mask thinking they're safe and get the disease because the masks don't protect you. With that, he got bounced off Twitter. In fact, that's why he recommended I go on Twitter, because he wanted to have some access to Twitter. Anyways, it felt like being a totalitarian country, right? Like this. In Soviet Russia, the scientists would talk to each other by these samizdat. Samizdat are like secret, typewritten documents that you send around in clandestine manner to your friends, because you couldn't use the printing presses. If you used the printing presses, the authorities would know you'd done it. Whereas a typewriter, you could do it alone, right? That's what it felt like. And that's the way we talked to each other during the pre-Elon era. Elon Musk closes $44 billion Twitter deal. This was huge, actually. This is a transformative moment. This is November 2022. He opened up the Twitter headquarters to a friend of mine, Barry Weiss, who runs a new journal called the Free Press. Some of you may have heard of her. She's an incredible journalist. She was at the New York Times and left because she couldn't. I guess she was canceled basically. But she started the Free Press. Musk, when he bought Twitter, invited Barry Weiss and a few other journalists to come and look inside the Twitter headquarters, looking at the databases. This is a picture of the Twitter database of me. I was on Twitter then. By 2022, I had 240,000 followers. Sounds like a lot of followers. The key thing I want you to look at is this right here, the word trends blacklist. That's something I didn't know was on my account. I was put on a blacklist by Twitter. A blacklist. When this came out, I got an email I got a text from Elon Musk. Not sure exactly how he got my number, but I got it on this phone. And I spent Christmas 2022 at Twitter headquarters with some Twitter engineers. They showed me this, so I can verify myself that I saw this with my own eyes. And I asked them, when did I get on this blacklist? And it turns out I got on this blacklist the day I joined Twitter, August 2021. This is what I posted the day I joined Twitter, Great Barrington Declaration. Right, that's still my pinned tweet. You can go see it if you go to my Twitter account. I now have 500,000. This is out of date. 500,000 followers, you guys. It's just crazy how. I mean, someday I'm going to close down my Twitter account, but not today. Anyway, so this tweet of the Great Barrington Declaration led Twitter 1.0, but pre-Elon, to put me on a blacklist. Why is that? They don't have an economic interest in my not speaking. What is it about the Great Barrington Declaration that's misinformation? I mean, you may agree or disagree with it, but it's part of the scientific debate, right? It's part of the policy debate. It should be something that we should be able to talk about. By putting me on a blacklist, they made sure that Twitter users did not see this, other than the ones that followed me. That's what a trends blacklist is about. And the question is, why did they do this? What would make them want to do this? Stanford also, so that's, I'm gonna get back to that question, because I know the answer, I think, to that question, but I want to put you on tenterhooks while you wait for the answer to that question. The universities also failed. I already told you about Scott Atlas. I'll tell you, for me, it was very similar, although not quite as public. I wrote a piece in Tablet magazine in January 2023 talking about this. I've been at Stanford for almost 40 years. I was an undergrad there. My email is jay@stanford.edu. I got the email when they first handed out emails at Stanford, which I have j@stanford.edu. I've loved the place forever. It's the motto of the place is "Let the winds of freedom blow" in German for some reason, and it's a fantastic place. It's been a wonderful place for me. During 2020, it was a nasty, terrible, vicious place. After that, I did that Santa Clara study. There were hit pieces done on me, on my wife, with allegations about financial improprieties, all these things that Stanford knew were false. And they nevertheless opened something they called a fact-finding, which involved me hiring lawyers to protect myself. They announced that they were doing this fact-finding, even though they knew the facts before they opened this. It felt like an inquisition. I couldn't sleep, I couldn't eat I lost 30 pounds of weight. I gained it back, but I lost 30 pounds of weight during those days of the pandemic. I've never felt anxiety in my life, but I felt that because my home institution that I loved and respected essentially was saying that I was a irresponsible scientist, like a corrupt scientist, falsely. My colleagues went after me in nasty ways. At one point, I told you about Scott Atlas and the attack on him in the faculty senate. Martin Kulldorff wrote a letter to the Stanford Daily defending Scott, and 98 faculty members accused Stanford colleague Scott Atlas of falsehoods and misrepresentations. Many opinions and statements run counter established science. Surprisingly, alleged falsehoods are not mentioned, making scientific discourse difficult. Among other things, the letter advocates hand washing, which Atlas obviously agrees with. So what are the disagreements? And Martin challenged any of the 98 signers to a debate over what Scott had said. And not one of them took him up. The former president of the university at Stanford tried in December of 2020 to organize a debate between me and somebody else at Stanford who disagreed with me, and couldn't get anyone on the other side to agree to debate with me publicly. In April of 2022, I talked with the dean of the medical school, and I asked him why he had not organized a COVID policy forum in 2 years. And he said that even in 2 years later, he said that it was still too early for a dispassionate academic discussion about COVID policy. This is an utter signal failure of our university. Right? It's our university, if it has any mission at all, is to lean into, at the most difficult times, these kinds of debates, especially when everyone else on earth is saying we shouldn't do it. We should have been at the forefront. We had people like Scott Atlas, John Ioannidis, Mike Levitt, and others who were perfectly willing to debate one side, the side I just showed you. And yet, we couldn't organize a policy for it. Princeton I've been to twice, by the way. You guys are way better, which I really appreciate. Like I said, it's an act of bravery to have me. Okay, so this is me. This is me right here. I forgot this is how anxious I was. Like, it's March of 2021. I left my house to go to Florida, and I left my suitcase at the front door of my house because I just walked to my car, forgot it. So I ran around Florida trying to find a suit, and I couldn't find one. That's Ron DeSantis, that's Martin Kulldorff, that's Scott Atlas. On TV, you can't see is Sunatra Gupta. This is March of 2021, and the governor of Florida is asking me, is there any good evidence that masking children protects children from getting or spreading the disease? And I had looked into this because I knew he was going to ask me. There are no randomized trials looking at children, at least of March of 2021. I think still today that the only randomized trial that even had children in it found no effect of using masks on children on spreading the disease. So this is what I told him. This led 100. Okay, so first of all, YouTube censored this video, and then 100 of my colleagues circulated a secret petition asking the president of the university to silence me because of what I said to Ron DeSantis. Martin and Carl Hennigan, who's an Oxford professor, I asked them to write what they thought about this, and they wrote this piece, which they got published in a conservative journal, which was brave enough to publish it. They circulated the secret petition. 100 of them signed it. I mean, two of my friends leaked the fact that they were circulating the secret petition against me. I then got the press, by this time I was well connected with the press, to go ask the president of the university if he intended to silence me. And of course he had to say no, right? And I think this is partly how you deal with this kind of censorship, is you lean into it. You make people who are doing the censoring own it. But think about this. Like, think about how we as faculty members engage with each other. Should we engage with each other by talking to each other in respectful policy fora? That's how I thought we engage with each other. Or do we engage with each other by circulating secret petitions, declaring each other anathema, trying to get each other excommunicated? Right? And during the pandemic, it was the latter. This is a kiosk on campus right near my favorite coffee shop on campus. This was put up all over campus. This is in summer of 2021. There was an uptick of cases in Florida. You see that arrow over there? I had said in that same roundtable, I'd said, we have protected vulnerable by vaccinating the older population, a pro-vax statement. I told this to Ron DeSantis. My crime was that Ron DeSantis tweeted this with a picture of me. That led to this campaign to put posters all over campus accusing me of killing people in Florida in summer of 2021 because I was saying that vaccinating older people was a good idea. I mean, a friend of mine sent me this picture, and for the first time in my life, I actually felt afraid to walk on campus. I called the Stanford police. I asked my department chair if he'd be willing to do something. They sent me to a counselor who told me to reduce my online presence. Anyways, this poster stayed up for months and months and months. Eventually, I decided I was going to just ignore it. But I felt like, we talk about safe spaces on campus. The reason I felt unsafe is because I was getting death threats at the same time as getting this. And you have a campaign accusing me of killing people for giving what I thought was good advice. And I've already showed you what happened to Florida all-cause excess deaths versus California. Okay. Now that you've been on tenterhooks about what caused this, I think I already hinted at this. Francis Collins was not alone in inducing this censorship effort. Oh gosh, I'm out of time. Okay, let me just finish this real fast. I got 2 more slides. The Missouri versus Biden case is a case brought by the Missouri and Louisiana Attorney General's office in 2022. In that case, I'm a plaintiff in the case. We got discovery into what the U.S. federal government was doing. The U.S. federal government is at the heart of the censorship effort. The U.S. federal government, what it did during the pandemic was that they would go to social media companies. And when I say the government, I mean the White House, I mean the CDC, I mean the Surgeon General's office, I mean the FBI, I mean nearly a huge numbers of people inside the U.S. federal government, they would go to the social media companies and tell them, you need to censor these people and these ideas. Ideas like there's immunity after COVID recovery, a fact. Ideas like there exist vaccine injuries, a fact. Ideas like, there's not very good evidence that masks stop you from getting and spreading COVID, a fact, right? Based on what the literature is saying, right? It's these arguable facts. They would go to social media companies and tell them, if you don't censor these people and these ideas, very strongly they would imply that we're going to go after you. We're going to destroy you. We're going to use our regulatory muscle to go after you and destroy you. That's what we found. We got to depose Tony Fauci. It's kind of fun. He said, I don't recall 174 times, but he didn't really provide much. Judge Terry Dowdy in Louisiana wrote this: the plaintiffs have presented substantial evidence in support of their claims they are victims of a far-reaching and widespread censorship campaign. The court finds they're likely to succeed on the merits of their First Amendment free speech claim against the defendants, that's President Biden. The plaintiffs are likely to succeed in establishing the government has used its power to silence the opposition. Opposition to COVID-19 vaccines, opposition to COVID-19 masking and lockdowns, opposition to the lab leak theory of COVID-19. The evidence produced thus far depicts an almost dystopian scenario. During the COVID-19 pandemic, a period perhaps best characterized by widespread doubt and uncertainty, the US government seems to have assumed a role similar to an Orwellian ministry of truth. Right, it's a federal judge writing this. This was then a federal appeals court agreed with the federal this judge. Actually, the federal judge, this Terry Dowdy, he said two things. It's not just that the government was doing this. The government was using academic cutouts to launder its censorship efforts. They still are. The Stanford Virality Project basically says, look, we're going to stop you. We're going to do research on people spreading misinformation online. It's the only research project I know of where human subject committees can say, yeah, it's okay to do research that's aimed at hurting the people you're doing research on. And then the government would tell Stanford Virality Project, oh, these are the themes we don't like. The Virality Project would go, Stanford would go to the social media companies and say, look at what our researchers found about how these people are spreading misinformation online. And then the social media companies would censor those people and those ideas. The judge, Terry Dowdy, basically said you're prohibited from the government's prohibited from directly calling up social media companies saying, you have to stop vaccine injury groups from talking. But the appeals court allows there to be this sort of indirect censorship through universities. The government still, under the appeals court ruling, not allowed to go and lean on social media companies directly. The US Supreme Court just heard a couple of weeks ago an appeal to this, and we're still waiting to see what they find. But I think this is the most important. I mean, I'm not a lawyer, and please correct me, Robbie, if I'm wrong. But this seems like a very, very important First Amendment case. It's one of the we'll hear in June what they do. But if we lose this case, what it means is that it's a green light for the government to continue to censor people online, to go lean on social media companies and tell them to censor these people and these ideas. The key thing is that the censorship is in service of protecting government's own misinformation. So that's the last slide. So we're done. But what we have is a dystopian scenario. We don't have free speech in this country, and that really is the reason why we had the scientific results that we had. Thank you.
So we'll just do a few questions. We don't have a lot of, thank you. We don't have a lot of time for questions. I want to quickly just ask one. Jay, my impression of the Supreme Court argument was that it did not go well for your side. Was that your own impression?
Yeah, I mean, I was there at the Supreme Court hearing, and I'd never been to the Supreme Court before. But I came into the room unusually optimistic. I'm usually optimistic, but it's like 9, and I thought we were going to win 9-0. I came out thinking we're going to lose 7-2 or 6-3 or something. I don't know. In retrospect, when I've listened to some of the arguments of the judges that were on the margin, I think we still have a chance of winning, but it's not going to be 9-0.
What was interesting to me is that the justices did seem to take on board the idea that there's a threat here to First Amendment freedom. But they seem very reluctant to cut back on the government's ability to engage in its own speech with social media companies. But we'll have to see.
I mean, I think that's a very important point. The key thing is, can the government go to press and say, look, I don't like this story? Yeah, they can do that.
Yeah, you had a really interesting question of what counts as pressure.
Right.
You know, the government's allowed to state its opinion. Government can have an opinion.
Absolutely.
It can take a side. But the question is what counts as pressure. And my sense was that the court just thought that is too hard to determine.
So can I make a point about that? So when the government calls up the New York Times and says, I don't like this story, you guys are considering, if you publish it, you're going to kill troops, right? Yeah. That is a direct contact with the editor and the writer of the story.
Agreed.
Here you have a third party saying, the government reaching out to a third party saying, censor Jay. And I have no idea.
Yeah.
Right? And that's a pretty big distinction, right? If they come to me and start to say, look, Jay, be quiet, it's one thing. That's more analogous. Here what you have is the government deciding at scale. Did anyone ever post anything on Facebook during the pandemic that got a little note put on it? It's the government that did it, right? The government actually itself was subject to the censorship campaign. In April 2021, the CDC puts this thing out saying that the J&J vaccine has some side effects. They paused the J&J vaccine. They've been pressuring the Facebook to have an algorithm to like tag every single vaccine injury article. They share the J&J vaccine pause, and the White House Facebook page is tagged as an anti-vax group.
Amazing. I'm interested, I know Professor Macedo is here. I'm not sure if Professor Lee's here. Professor Macedo and Professor Lee in the Department of Politics are doing an important book that will be out when, Steve? Not very long from now. And I'm just wondering if there's any questions you'd like to raise or anything.
Just ask the question for following up on what you said.
Yeah.
Is this mainly a case of people who should know better not behaving according to their professional norms? Or are there institutional reforms, aside from the Missouri versus Biden part, that need to be enacted to try to make the situation better in the future?
Yeah, I didn't know they had this power before the pandemic. And what I view this as a tremendous abuse of power. And the fact that the power exists within the NIH, the CDC, the FDA to act in the ways like this, that points to me of the need for tremendous reform inside, like ethical reforms and structural reforms. So this kind of strong arming of outside scientists never happens again. I don't think that this case is enough. It's not sufficient, but I do believe it's necessary.
Jay, earlier Professor Jackson raised the question, is it incompetence or mendacity? And it struck me, Tim, that there's a third possibility, which is ideology. So can you address that?
I think we're scientists, so we're idiots. I mean, that's just the norm, right? We are always wrong. And the way we get to be right is by sharpening each other, by pointing out that we're wrong to each other. Like we don't need perfect scientists. We don't need scientists to stop what we need is scientists to be able to talk to each other. And we need to have a fair and open playing field. Universities, that's our job in universities. That's our mission. Yeah. That's so even whether it's stupidity or, I mean, I think there's all kinds of motives involved here.
College adoption, you were not a friend of an epidemiologist. That's just
it's just an abuse.
Well, you sort of don't get tenure at Stanford by right. So let me ask for two questions from the floor. Okay, yes, one up here, sir.
I'm probably one of the people in the audience for whom, thank you, microphone. I'm one of the people in the audience for whom the facts that you show are not new. I think this is well accepted now. But I think you didn't address one thing, which I wonder if you could speak about. What you went through was personally horrific. What a good demeanor about it now, but it was horrendous. What happened in this country was people often probably worse than McCarthy's. Can I ask you, why do you think it happened, and why does it happen? Because people who were good friends of yours denounced you.
Yeah. I think we were in a, I mean, I could give you stories about the financial interests and all this, but I think the central thing that enabled it all was a moral panic. And I think it's a moral panic from a threat to our own mortality that we weren't used to. But we in the West are used to the idea that we've somehow conquered infectious disease. Infectious disease is something that happens to somebody else. And when we're faced with this like mortal threat, we're no longer ourselves. We act in ways that are so far outside ourselves that would become almost unrecognizable. I think that's the root problem we had here. And that happened even more at universities, and the more educated people were, the more likely that was to happen than otherwise. I don't know how you protect against that, but I think that's the root thing. I think it was fundamentally mortal fear that was the root cause of it.
Yes, madam. John, can you give her the, yeah, thank you.
I'm wondering if you could say a few words about this new WHO treaty. I don't see nearly enough coverage on it. I saw there was a massive demonstration against it in Japan and also in some African countries. It seems to centralize power for future pandemics in this organization that's extra-national, which we haven't voted for. And given how poorly this pandemic was executed and the policies, why would we give away our agency in this area, and why aren't people talking about it?
You'll have to explain, Jay, what this is.
Sure. So the WHO, there's a new treaty being negotiated. The premise of the treaty is that WHO did not have sufficient capacity to convince world governments to do exactly what it wanted. And the political economy has been really interesting. It's the poor countries that were pushed back against the treaty, right? I did on this podcast I now run called the Illusion of Consensus podcast. I interviewed a Kenyan philosopher, Reginaldo Duro, who described to me what like the African opposition to the WHO treaty. For Reginaldo, he views this as a neo-colonial operation. It's essentially establishment of Western autonomy over the policy of poor countries. And so we'll see what happens with it. But I think that it's a lot of what you're seeing of the discussion of the WHO treaty is there's this like north-south divide. And I think it's tremendously, if the WHO had been perfect during the pandemic, I still would have worried about giving them power. Given the way that they actually ended up operating, where they pushed lockdowns in the poorest countries, harming the poor, I can understand why poor countries would say no, and hope they do.
Massive demonstrations, and you don't see any coverage of it in our press.
When you say Western, it's Western elites. It's not like ordinary people.
Yeah, it's not
yeah,
right.
yeah.
Right.
Well, I'm so sorry that we have so little time for questions. Thank you for joining us for the annual Shapiro lecture. I hope you'll come back again next year. We have plenty of other lectures, some coming up. You can read about them on our website. And please join me in thanking Dr. Bhattacharya.